Hey Bernie, Tim Handren, your mayor. It's July 2nd, Thursday, July 2nd, and I wanted to give you a quick update on several things again. Lots going on in the last couple of days since we put out the declaration to require the 4 large businesses in our community to have policies that are going to go into effect tomorrow. So I just wanted to put a little bit of context and maybe talk about what's going on in our community. But before I do that, let me just offer you this. You know, it's funny, I was looking at the calendar today. 18 months ago today is when I declared that I was going to run for mayor of Boerne. The reason I ran for mayor of Boerne was, I assure you, not to be dealing with COVID-19. It was not to get in a position where I could control people's lives. The reason I ran for mayor of Boerne was because I wanted to help bring my business background and help do some long-term planning for our community. And what we're doing right now during this COVID-19 crisis is anything but long-term planning, because every single day we're learning something new. The big deal is what's going on next door. Just south of us in Barrett County, 12,500 total cases to date, 7,500 that are currently active in Barrett County. And you've seen the spikes happen over the last couple of days. That's Barrett County, that's not Kendall County. Tim, why are you even talking about that? There's not a magical thing that happens when you cross the county line from Barrett County into Kendall. There's no magical, no viruses here sign, and there's no magical thing that says that county line is a demarcation. It's just a line on a map. And there's a lot of people that are in the city of Boerne that work in San Antonio, and there's a lot of people in San Antonio that work in Boerne, and there's a lot of people that come to Boerne just because they love Boerne. And so we have to admit the fact that Barrett County has a situation that's growing out of control fairly quickly, and that could very easily spill over into our community. Listen, this morning I posted a story that CNN ran this morning. CNN was in Methodist Hospital in San Antonio 3 days ago when they filmed the story, and they ran it this morning, and they showed a fairly not great situation that's going on in that hospital. It's just the Methodist Hospital, and they showed a situation where there's a lot of patients in there, a lot more COVID-19 patients than actual other patients. And they talked about how stressed the medical community is. Just because it's on CNN doesn't mean that it's not true, by the way. It's a news story. And I actually, when I watched that this morning, I called Dr. Ken Stiskel. You might remember, Dr. Ken Stiskel is our Kendall County local health authority. He is a paid part of Kendall County to be their director of health. And I called him this morning and I said, does that story represent what's accurately happening? And he said, 100%. If you don't know, Dr. Ken Stiskel is an ER doc, and he goes to San Antonio every day, and he circulates among many of the ERs as a professional, a healthcare professional, and he's helping out with those. Again, he's not somebody sitting behind a keyboard giving me an opinion. He's in those ERs every single day, and he said that's very accurate representation of what's going on. Certainly at Methodist, they're getting hit harder than others, but if you go to university, if you go to the VA, he said you're going to see the exact same thing. 7 of the 10 hospital floors in Methodist are COVID-19 patients. As I talked to Ken more just about that story this morning, it's very real in terms of what's happening in San Antonio. And here's the challenge, and this is what we've been saying all along. If all the hospitals in our hospital system in San Antonio are flooded with COVID-19 patients, and then you have just a regular run-of-the-mill accident, car accident, or you have a stroke, or you have a heart attack, or you have some medical need, and you need to go to the hospital, and the hospitals are full, what happens? And candidly, folks, I just want to remind you, that's been the #1 concern about this insidious virus, is we don't want to overwhelm the healthcare system, because then we have a very different problem. I saw a response from Dr. Brian Fowler. He's part of an advisory group that I go to for all my healthcare expertise. We have 5 doctors in this community that are a healthcare advisory team. I spent 2 hours with them a couple nights ago to talk about all things COVID. The other thing we have to worry about by overwhelming the healthcare system is not having a place to go if we get sick. You can't just go and have a draft of healthcare workers. If those guys get sick, there's nowhere else to go. And that's really, again, that's been the #1 concern. This is not sensationalism. This has always been about protecting the healthcare system so that we have a healthcare system that we rely upon. Does a mask prevent you from getting COVID-19? No, none of us are so naive. Does a mask, a simple bandana, stop COVID-19 from passing between it? No, we all know that. But we do know that it is effective in slowing the spread of the virus. That has been proven. It's more effective than shutting down businesses. That has been proven now. And when I talked to the doctors, again, 2 nights ago, for over 2 hours, they are 100% supportive of the mask. 100%. These are the healthcare professionals in our community, your doctors and my doctors, frankly. What kind of doctors are they? They're primary care physicians, they're respiratory experts, they're ER docs, and they're pediatricians. It's a broad gamut of doctors that are advising me and telling us what they think is the right next step to take. So the wearing of masks, CDC endorses it, WHO endorses it, and our local doctors endorse it. This isn't me making up my own opinion. I do a lot of homework, believe me, a lot more than I ever anticipated having to do on COVID-19. Part of the confusion, I think, in what people are looking at online, whether it's on Facebook or other places, is you're going to find data that's old. I had people send me stuff from February where Good Morning America said masks may or may not be helpful, but that was February. And several months have passed. We're in an iterative learning process about COVID-19, and that's the frustrating part for all of us. It's frustrating for me, trying to make decisions that are relevant. It's frustrating for the doctors, trying to do what's right for their patients. It's frustrating for all of us because we're locked down and we're not able to do the things that we like to do. It is terribly inconvenient. I don't like wearing a mask, but when I go to H-E-B, I'm in there for 15 minutes, I put it on, and I go home. It's not that big a deal, guys. I see a lot of you really, really fighting it, and you're spending more energy fighting it than you're going to spend in H-E-B and Walmart, frankly. It's to be thoughtful of others in case you're an asymptomatic carrier. Some of the data I get from the doctors, 60% of people are asymptomatic. You don't know if you have it or not, depending on where you've been, and it's polite to be thoughtful of others. That's the whole purpose of wearing a mask. So I just want to give you that context. I think that's important. I want you to understand where I'm getting my data from and why we're making these decisions that we're making. Listen, it's July 2nd. This is the July 4th weekend. Just to be clear, we didn't cancel July 4th. It's still going to happen. We canceled the fireworks on July 4th because we don't want to create a situation where a bunch of people are congregating in Boerne. I would encourage you, just as I have on all the prior vacations, listen, be with your loved ones that you live with, celebrate Independence Day and what America is all about. But I'm going to encourage you, don't congregate with a bunch of people. This outbreak that's happened in San Antonio and a lot of the urban areas is coincident with reopening the country. It's coincident with a lot of marches and protests and a lot of big crowds coming together. It's coincident with a lot of things. Which is the cause and effect? I'm not going to hazard a guess at that. Fact is, a lot of people have become sick very, very heavily in the last 2 weeks, and there's always a delay. What we're going to see from the doctors' opinions that I met with, we're going to see a lot more hospitalizations over the next 2 weeks as this infection continues to reveal itself, and fully 10% or more, but easily 10% of everybody who gets COVID-19 gets hospitalized. That's a big number. We got to prepare ourselves for it, and we got to find a way to coexist with this until a vaccine can come around. So again, I'm telling you what I know. I hope you do your homework. I'm doing a lot of my homework. I'm not making flip decisions. I'm trying to do what's right for our community. I would just encourage you in this long weekend, stay home, stay safe, and don't congregate in large crowds. And for the 10 or 15 minutes that you're in Walmart or H-E-B, just wear your mask for the others. It's not for you. Happy 4th of July, everybody. We'll talk to you next week. Thanks.